I'd like to bring to the stage next Mayor of Holly Springs, Kelvin Buck, and he's going to introduce you to Justin Hall.
Thank you. Thank you very much, Trey. I appreciate you and the work that you've done with this program and making sure that we all are familiar with what's going on with the program. Let me begin by saying good afternoon, of course, and I want to say to the mayor of Canton, we didn't have that many movies shot in Holly Springs. We had Cookie's Fortune. Some of you may be familiar with that movie, and they did pretty well. And Mayor of Batesville, we didn't. Our football team hadn't won a state title in a while, but our basketball team has. So we can certainly applaud that. You know, Holly Springs is a small town. Much like many of the small towns across the state, we have a really charming town square, and we have events like the Hummingbird Festival and the annual pilgrimage. These are the kinds of things that really make a community and a neighborhood. You know, we have Russ College, which is one of the oldest historical institutions of higher learning in the state of Mississippi. All of these things make up our community, and you know, we kind of like it there. This initiative that the governor, and we all should applaud him for, has really been an opportunity for our town, a small town like Holly Springs. You know, when I first saw it, and being a member of the legislature, I had the opportunity to see this legislation, and I immediately saw the potential in it. I immediately saw how this kind of legislation could be a big plus to a community like ours, in that we were always faced with some challenges as it relates to the access to health care. We were challenged with the possibility of having the economic development and jobs that come along with it. And so we knew what it was like to try to use an economic tool such as this to build on our economic prosperity in the community. But it really began actually with my experience with a private owner of a hospital there in Holly Springs, a small 40-bed acute hospital called Alliance Healthcare System. In fact, the president of that hospital, the CEO of that hospital, Mr. Perry Williams, is here today. And some years ago, they were committed to trying to make a difference in our community as it relates to their commitment to affordable and accessible health care in our community. And so that commitment led them to come up with some ideas as it relates to a plan, and they planned what we call the medical campus some years ago. Now, the problem with that plan is that, as it has been mentioned earlier, a plan like that requires that you have the kind of funds that will allow you to do the development, or at least some incentives that would allow developers to come in and make the investment. And so the plan was there. The commitment was there, but what we lacked was some of the funding and some of the incentives that would make it a feasible thing to do. And so, lo and behold, I'm sitting in the House chamber as a member of the Mississippi House of Representatives, and we run across the legislation that would establish the health care zone. A wonderful initiative, Governor, and we certainly appreciate you. And I think early on in the process, we shared with you that we would be behind this legislation 110%, and we have been, and we supported that legislation all the way through the process. And so we're just delighted to now say that we're one of the communities that now has a plan that's on the table. We're one of the communities that has now been able to benefit from the process that would allow some of the housing development to be done. We're seeing some of those housing developments coming up right now. In fact, I'm sure the gentlemen are out there working on that complex some today. And that's because of the initiative that has actually been a piece of legislation that really means something to the people of our community. And because it means something to the people of our community, because it has made a difference, we are right now as a community poised and ready to build upon that and add that to the portfolio that already exists. Now, with me today is a gentleman that works with our Industrial Development Authority, Mr. Justin Hall. Now, Mr. Hall will share with you some of the other initiatives that will be combined with our healthcare zone initiatives and show you how Marshall County and Holly Springs has paired up with the public sector and the private sector, and how we have also partnered with the different branches and sizes and levels of government just to make this work for a small town like Holly Springs. Ladies and gentlemen, Mr. Justin Hall.
Thank you, Mayor Buck. I'm going to get a little water here to get started. I'm excited. Mayor Buck took over office as the mayor of City Holly Springs on the 1st of July, and he was definitely an asset to the Mississippi legislature, and we're looking forward to what he brings to the table as the mayor of City of Holly Springs. I'm not going to overwhelm you with my wealth of knowledge about the health care bill. I'm here to tell you what it's going to mean to our community. It's exciting. We're in an area, we're growing, and I'm going to tell you a little bit. I'm going to lead up by showing some projects that we're currently working on, our location, how important this healthcare zone is to our location, and try to sell you a little land in Marshall County today. The Marshall County Industrial Development Authority, they operate as our economic and industrial development hub for Marshall County. They serve all the municipalities, Holly Springs, Pottscamp, and Byhalia in our community. They were created in 1984 by special legislation. They have a wealth of jobs. They own and operate a wastewater treatment plant that serves one of our parks. They manage all the industrial parks. We also manage the Holly Springs Marshall County Airport. It's a growing airport, and it's a great asset to the community. We have a 13-member board. We have mayors, engineers, bankers, business owners. We've got a great mix of board members, definite attributes you're looking for, visionaries. They all are leaders and looking to the future, and they've laid out some plans that are starting to come to fruition. Well, I lost my screen. Main objectives of Marshall County Industrial Development Authority are we're making it simple for the businesses. We're the one-stop shop. When you come into our area, sit down, talk to us. We try to make it easy to do business, make it attractive to companies coming and looking at our community, and also we're increasing the tax base, creating jobs, and improving the quality of life. Stop in Holly Springs. This is our office. Come and see us. Location. We're in a great location. We're in the Memphis metropolitan statistical area, and our road network is a definite asset. You can see we're bisected by future I-22, Highway 78 currently. I-269 is currently under construction. This is the new intermodal highway of the future. It's the direct connection to Canada and Mexico. This is going to provide, when it's completed, direct connection to I-55 and I-40 from Marshall County. We have 3 rail lines that serve Marshall County, and we're within 30 miles of the Memphis International Airport, the FedEx Hub, and the Port of Memphis. Show you a quick little map of, I'm losing my screen here. If y'all can see it, we're good. Just to kind of point out the area, get you a visual here. 30 minutes from Memphis. We're about 50 minutes from Tupelo to the south. We've got Batesville, Sonny just talked, is down by on 55. Also Senatobia and Northwest Community College. They're a huge player. They're playing a major role in our economic development. The programs that the Mississippi Community College system offers to these companies coming in are just unbelievable. Training and career technical services. Skip to the next slide here. This is just an example of our rail net. This is important as we're moving to the future. We have the accessibility to 2 major intermodal yards. We're talking about, as far as pharmaceutical companies, warehouse and distribution, this can play a major role, but these are also enabling us to attract more manufacturing-based companies. The past 3 years, Marshall County has secured and had commitments of over $300 million. We've also created 1,200 new jobs. Currently, we have 2 major facilities under construction. They're coming up. We've got manufacturing facilities as well as warehouse distribution facilities. A couple of names you might recognize. Roxville, they're a new Danish company. We're excited. This is their first endeavor into the U.S. They've got 31 operations in 4 continents. Thomas & Betts have done major improvements over the last few years, added jobs. A6 Footwear and contract fabricators. We're seeing a lot of local homegrown businesses really flourish over the last 3 or 4 years. Some really, really nice skill sets too, welding, fabrication jobs. Marshall County is a large county. We're approximately 715 square miles, experiencing quite a bit of residential growth. Our workforce, and this is a real selling point for us as we attract industry, is we have a workforce in the 40-mile radius of Holly Springs of 621,000. Working on this project, I found some interesting numbers. I think we have about 12.5% of that 621,000 is related to the medical industry. So with all the hospital, Le Bonheur, St. Jude, UT Medical in the Memphis metro area, as well as the existing facilities in DeSoto County, those numbers are large. We have a lot of trying to capture those jobs and keep them in Marshall County. I know numerous medical professionals that are living in Marshall County and Holly Springs that are commuting 50, 60 miles to fill jobs in other places. So we're excited that this is going to start keeping some of those jobs at home. We talked about baby boomers. We have a large population of over 65. We have a lot of retirees moving into Marshall County, but we've got the antebellum homes in Holly Springs are a great attractor, and then we've got a lot of growth coming out of Memphis in the north end of the county. Talking a little bit about the health care plan, I'm going to let Chris Watson tell you maybe more detail, but in 2008, the Holly Springs Commons PUD was created. This was a joint effort between the city and the county, really got things moving. There were plans. Alliance Healthcare was planning on building a new hospital and still have plans to do that. Dr. Williams was wanting to set up a state-of-the-art medical facility. Marshall County and Holly Springs created a TIF district to help finance this, and I believe currently over $9 million have been invested in direct infrastructure dollars to get this plan and district in order. Part of this PUD, we created 32 acres are reserved for medical-related industry. Here's a map of the PUD. I have to look down here to see it. 220 acres. All these sites in the green that are highlighted are pad-ready sites. They consist of retail, commercial. The area in the red would be the 32-acre medical park. The purple area is already has been built out. Williams Medical Clinic sitting in that location at the moment. The healthcare plan, we had four major goals that we wanted to implement, and phase 1 is already has been implemented. Williams Medical Clinic built in 2008. They're currently they have state-of-the-art facilities, really nice. It's a definite asset to the community. Currently seeing about 35,000 patients annually. Phase 2, we're still working with Alliance Healthcare to get our planned hospital in. Phase 3 will consist of a health and wellness center. We'll kind of educate the public, have some activities, a center there, to walking trails. And also phase 4 is going to consist of a School of Allied Health. We're going to work with Northwest Community College, our community college system, and also the Career Technical Center in Holly Springs to start training and creating jobs locally and having placement in our community. Just going to wrap up real quick. Keys to our success have, okay, here we go. We've got the medical park. You can see Williams Clinic in the northwest corner. Hospital's planned to be just south of that, and then the Wellness Center and the School of Allied Health will be behind. Keys to success in Marshall County, we're continuing to grow. Everybody we're working with, any industry that comes in, it's a statement to the governor and the staff at MDA that the attractiveness of Mississippi, the incentives, and the willingness to do business, is going great. We're competing with a lot of states and attracting a lot of business. This economy has been tough. Right now, everything's driven by incentives. The market is really a challenge, but we are seeing in the last 2 years, it's been a huge breakthrough, and a lot of companies are coming to Mississippi, and we're looking forward to welcoming them. Hopefully have a few groundbreakings here in the next couple months, Governor. Workforce, infrastructure, location, and a business-friendly local and state governments are the keys to our continued and future success. Contact information is at the bottom. Be glad to give anybody a tour if you're ever in our area. Thank you.